This is an I Am Listening exclusive podcast.
If you've had an infection, if you think you've got an infection, if you feel worse than you've ever felt before, then seek medical attention. And as you have said earlier, don't be afraid to ask the question. It's not a silly question. Do you think that this may be sepsis is such an important question and it needs to be asked.
Welcome to Doctor Nicki Explains. I'm Doctor Nicki, a GP of 24 years experience, and this is my friend Sarah.
I'm a mum of 4 with no medical background.
We've decided to do a podcast to explain medical conditions, hopefully in an accessible way. We often have a guest speaker who has experience or expertise.
The podcast is not a substitute for seeing your GP. If you have medical symptoms that are troubling you, please see a doctor.
We've based the podcasts on NICE guidelines, which is the National Institute for Clinical Excellence.
The podcasts do contain graphic descriptions of medical conditions and may not be suitable for a younger audience or those of a sensitive nature.
Thank you for listening. So today we're going to do a podcast explaining sepsis. I'm Dr. Nicki.
And I'm Sarah. And I'm Abby from Sepsis Research Feet.
And we are really lucky to have Abby with us today as our guest speaker. And just to have an expert speaking to us about sepsis is just brilliant. So thank you so much for coming.
So, Abby, how on earth did you end up getting involved with sepsis? So I have something of a personal connection to sepsis in that my father had a urinary tract infection about 8 years ago, and he was developing sepsis, and that was recognised very quickly by a nurse who was treating him, and he was treated very successfully. So I will be forever grateful to them, but it was a very clear indication of getting medical treatment quickly for sepsis really helps. I then came to the charity about 4 years ago on a professional basis as a fundraiser and communications manager.
So I think we should probably start by saying, by kind of describing what sepsis is. So what's your charity's definition of sepsis?
So in its simplest terms, because sepsis is enormously complicated as an illness, what we talk about when we speak to the general public is sepsis being an overreaction to an infection by the body. So where you would normally expect the body's immune system to deal with the infection kind of at source and stave it off and the antibodies go into work on it, what happens with sepsis is that the inflammation and the body's reaction go system-wide. And that inflammation means that the body basically starts to shut down things like the blood supply to key organs. So you can end up with organ failure and potentially, in the worst case scenario, in death, sadly. So how many people globally or in the UK does sepsis affect? So the estimate, because the statistics are not altogether accurate, sadly, but the estimate is that worldwide every year sepsis affects around 49 million people. 49 million? 49 million people worldwide every year, and will result in the deaths of around 11 million of those people. On a UK level, it's estimated to be around 250,000 people affected every year and around 50,000 deaths. And to put that in context, that is more deaths in the UK every year than due to breast, bowel and prostate cancer combined. So it is a huge number. So Nicki, why are we not more aware, lay people like me, why are we not so much more aware about sepsis? Do you see a lot of it in the surgery?
The thing about sepsis, I think, is that you have to have it in the back of your mind because obviously as GPs, we see infections all the time. So people come in, we'll see sort of 30 to 40 people a day with respiratory infections and urine infections. And it's quite subtle sometimes, the signs of sepsis, particularly at the beginning of the illness of sepsis beginning to start. And so we will discuss what measures we take to see if sepsis is present when people come into the surgery. And there are ways that we can have a look at that, that we should be having a look at patients as they come in and assessing them to see if they have sepsis. So we'll talk about that a bit later. It's also true that about 2,000 children get sepsis a year in the UK. So it affects all age groups. And with an incidence of around 360 cases per 100,000 people per year, a mortality of 20%, and with people presenting early being about half as likely to die as those presenting later, it's estimated that about 1 in 2,500 episodes of awareness has the potential to save a life. So by raising awareness here, hopefully on the podcast, and with all Abby's work in her charity, we can actually save some lives and make people more aware of what to look out for, which we'll cover.
So if it's an infection, why can't you just treat it with antibiotics?
I think the point is, obviously Nicki will know even better than I do, but the point is that it's not actually the infection, it's the body's reaction to the infection that is sepsis.
Right.
And some people, for whatever reason, will have an overblown reaction to that infection, where one of us might get a urinary tract infection or a cold and, something respiratory and recover. Other people won't. And it will escalate and become really critically ill for them.
Nicki, can you predict which people will be susceptible to sepsis, or is that not possible to predict?
So, first of all, sepsis is indiscriminate and it can affect anybody at all. So that's the first thing. So it can affect anyone, but there are some people who are at higher risk of getting sepsis. And it's not really known why, as Abby just described. Some people form this abnormal reaction to an infection and some people don't. We don't really understand why that happens. But you can develop sepsis after a viral illness or a minor injury, and it can affect anyone regardless of age or their state of health. So, you can be completely fit and well and have a minor mild infection and still get sepsis. So it can be in anyone, but some people are more vulnerable, and those are the very young, so under a year, the older population over 75, or the very frail, or those with an impaired immune system because of illness or medication, those that are pregnant or have just given birth, had a termination of pregnancy or miscarriage in the past 6 weeks, those with indwelling lines, so those are people that have got in hospital with having drips and things, or catheters, those who've had invasive surgery, so anyone that's had an operation in the last 6 weeks, those who are IV drug abusers, and any breach of skin integrity, so any burn, cut, infection or blister. So those people are more likely to get sepsis. And there are potential sources of infection. So those with a chest infection causing pneumonia, those with a urinary tract infection, those with a problem in the abdomen, such as a burst ulcer or appendicitis, those with an infection of the skin, such as cellulitis. Itis just means inflammation. Cellulitis is basically where the skin, if you notice it comes at the site of a cut and then you get this redness spreading up the skin in a sort of confluent red patch. That's cellulitis. And you can have temperatures and things. Rarer causes such as meningitis and viruses even such as flu. But it can be caused by a lot of different germs, not just viruses. So Streptococcus, E. coli, MRSA, there's a bug called C. diff. So most cases of sepsis are caused by common bacteria, which don't normally make people ill.
So, Abby, how would someone know whether they've got sepsis? What are the signs?
There are a number of key symptoms, but I think the point is really that you are probably going to feel worse than you've ever felt before, and you will potentially start to experience things like a very high or low temperature, confusion, shivering. You may not pass very much urine. There's typically people won't pass urine within a 24-hour period on the level they would normally expect. Some of those are key symptoms, but it's this sense of being more acutely unwell than you've ever felt before. And I think, that's relevant personally, knowing yourself, but I think it's also really important to recognise that patients developing sepsis often are too confused to see those key things in themselves. So it's up to other people around them to be as aware as they are. And also crucially, of course, in children, as Nicki was saying earlier, you have to advocate on behalf of a child, and only a parent will know if something is really out of the ordinary with their child, if they are seeing symptoms and behaviour that is really atypical for that child. And that is the point at which we would say, trust your instincts as a parent.
Okay, so
there are some signs in adults that we worry about that Abby's touched on, actually. So we say slurred speech or confusion. Confusion is an interesting one, actually, because I once missed sepsis in an elderly lady with a urinary tract infection who was just a little bit confused. And I did pick it up eventually, but I was a bit slow to pick it up. And confusion, it is quite a subtle thing. And as Abby says, that's why you have to rely on relatives and friends and people that know that person well, that actually, they're not normally like this. So confusion, slurred speech, extreme shivering or muscle pain. And again, muscle pain is a bit of a vague one. Passing no urine, which you mentioned. severe breathlessness. So if you're really out of breath, feeling like you're going to die, which I think is what Abby's saying. Basically, you feel like, you are going to die, and skin mottled or discoloured. So those are adult signs of sepsis.
We've talked about adults. Are there any key signs for sepsis in children, Nicki?
So we worry if children are breathing very fast, if they have a fit or a convulsion. Sometimes that's a febrile fit, so it's because they have a temperature. If they look mottled, bluish or pale, if they have a rash that doesn't fade when pressed. But actually, you have a low threshold if they've got a rash, full stop, really. I mean, of course, you can get a rash without being septic, but any rash can be a sign of an infection. If they're lethargic or difficult to wake, so that's a really early sign, actually. Sometimes in the surgery, we'll see children that are quite irritable. They're not happy and they're just not themselves. Or if they feel abnormally cold to the touch. If they're under 5, it's a bit more tricky. So sometimes if they're not feeding very well, if they're being repeatedly sick, or they haven't passed urine for 12 hours, those signs, you just have to think, could it be sepsis?
That sounds important, that you were just both saying that it should be on our radars.
I think that's absolutely it. And I think the thing is, we don't want to scaremonger, particularly with parents, because any parent, particularly a first parent, is always going to be really anxious about their child's health. But equally, we want to find a healthy balance where people, as you say, have it on their radar. And so actually, if they're seeing any of those symptoms, and again, just they have a sense that it's not how their child normally is, it's not right for their child, then I think that's the point at which we would say really seek urgent medical treatment.
Nicki, the business of a temperature, do you have to have a temperature if you've got sepsis?
So no, you don't have to have a temperature, although you might have a temperature. So temperature is one of the things that we look for when we assess children and adults with infections, and it forms part of this something called the News score, which is a way of looking at sepsis, which I will tell you more about. But you're absolutely right. You can have sepsis without a temperature. And in fact, the patient I described earlier who had the urinary infection and was confused, she didn't have a temperature. So yeah, you don't have to have a temperature. But what we do is we assess the temperature, the heart rate, the respiratory rate, the blood pressure, the level of consciousness, and the oxygen saturations in those over 12 with suspected sepsis. And then we come up with a kind of score, basically. NICE guidelines, which is the National Institute for Clinical Excellence, give you a sort of structure on which to refer based on the results of those examinations. There's something called, in smaller children, capillary refill time, which is not something that parents need to worry about. But in the surgery, what we might do is just press on a nail of a child and see how long it takes the nail to pink up again when we release the pressure. And sometimes if that's slow, that can also be a problem. We might worry about that. So we worry about, as I said, mottled skin, looking a little bit bluish around the lips and the tongue, any rash that's not blanching in particular, and any cuts or breach to the skin integrity, or any other rash. I've discussed that already. And then we want to know how often the person's urinated in the past 18 hours. And we do ask about recent fever, but it's just one of, as you can see, it's one of a whole picture of observations that we make. Because, as you know, lots and lots of children and adults come into the GP surgery with a temperature, and by far the vast majority of them do not have sepsis. So we definitely don't send everybody with a fever to hospital. Fevers are common, but so it's part of a picture.
So, Abby, if you suspect someone does have sepsis symptoms, what should we do? What should a parent do? What should a concerned relative do?
We would always say seek urgent medical attention. There's UK-wide slightly different advice onto what that actually represents in terms of, do you call 111? Do you take yourself straight to A&E? I think you have to do the thing that in your circumstances is going to get you the best chance of help as quickly as you possibly can. And, for some people that will be straight to A&E. I do know people who've said, actually, it was my GP who saved me, because my GP knew me. They knew how I normally am. They knew that I'm not somebody who kind of is a malingerer and will make up conditions. And they could spot immediately the problem, and they got the patient blue lighted to hospital. So I think, the advice would be urgent medical attention in whatever form that is best for you at the point where you are, time of day, everything else.
I keep mentioning something called the NEWS score, which is an early warning score for sepsis. And as I said, it is using some of the criteria that we've discussed, and it's not something that patients need to know exactly how it's calculated, but just to know that there is a system of scoring all these different things based on, say, for example, a low blood pressure or a low oxygen or a high fever. All these things are given weighted points, and then we add up the number of points. And then that will inform us as to how urgently or how likely this is to be sepsis. So that is a tool we can use.
So time is of the essence, Abby.
It absolutely is. There are significant pieces of evidence that suggest that the earlier you treat sepsis, the more likely you are to be able to successfully save someone's life. And as well as saving lives, it's about improving outcomes, because even of those people that survive sepsis, a lot of survivors can go on to have really significant life-changing side effects. So you can recover from sepsis, but you can end up having multiple amputations, for example. You can suffer from PTSD. There are lots of cognitive, psychological, emotional issues that can happen as a result. So the sooner you get somebody treated, you are giving them the best possible chance of a good outcome and survival.
So how are they going to treat you if antibiotics don't always work? How can they treat you when they get to hospital?
So they will give you antibiotics. They will try and treat the infection that's caused the sepsis, but ultimately it's going to be about supporting your organs. So worst case scenario, you might need to go into intensive care and have dialysis, for example, to take over the function of your kidney that's not working at the moment. You might have to go on life support. I mean, it's about allowing the organs to start working again. So they'll get rid of the infection, and then they'll support your blood pressure in hospital to allow the blood to perfuse all the organs and slowly get rid of all the abnormal. When organs are in distress, they produce a lot of molecules, poison basically, into the body that needs to be got rid of, excreted. Is that the right word? I wanted to pick up Abby's point about something that we call post-sepsis syndrome, which is basically the fact that 40% of survivors of hospital admission with sepsis do experience long-term outcomes that are adverse, particularly if they've spent time in critical care or if they're elderly or have significant health problems before sepsis. But it can affect any age, and it commonly takes 6 to 18 months to recover, some survivors taking considerably longer and never resuming their pre-sepsis state of health. So as we've discussed, there are sort of 3 types of category that this falls into. There's a physical category, a psychological category, and a cognitive category. So the physical category, you might have excessive tiredness, poor mobility, muscle weakness, breathlessness, change in sensation in your limbs, swollen limbs, dry skin, hair loss, joint pains, poor appetite. So there's quite a long list of those sort of things. And then psychological, you can have anxiety, depression, flashbacks, nightmares, poor concentration, short-term memory loss, mood changes, loss to your confidence. And obviously cognitive is the way your brain functions. So as Abby says, even if you survive this, we need to put all our efforts into trying to make it recognisable as soon as possible so that none of this stuff happens, and that we pick it up as soon as we possibly can and refer it in urgently. One of the ways you can do that is by using vaccinations. What's your view on vaccinations, Abby?
Well, I think it depends, doesn't it? Because as you said earlier, sepsis can arise as a result of multiple infections. So it can be viral, bacterial, fungal. Obviously, vaccination is only going to work for a certain tranche of those.
But we do have a lot of people reluctant to have vaccination.
Yeah.
Levels.
Yeah. And, it's obviously a personal choice, isn't it? In terms of vaccinating against common illnesses that might prevent sepsis, then logically, it would seem to be a very good idea, but there is no one vaccination that could prevent you from getting sepsis as things stand. Fingers crossed in the future, maybe there will be, but that is, if it's even a possibility, it's a long way off.
So vaccinations, presumably good hygiene, if you have a cut, covering your cut and...
Yeah, making sure you disinfect a cut, absolutely. Any kind of abrasion, as Nicki was saying, any kind of break to the skin, you can be really blasé, can't you? If you scratch yourself in the garden, you just kind of wash it off. actually, you need to be very careful because anything tiny like that, if the right bacteria is present, then you could end up with a very serious infection. So yes, absolutely, good hygiene is key.
And don't forget the risk groups, just having a lower threshold maybe for thinking about sepsis in certain groups that we've discussed. But one I wanted to particularly highlight is neutropenic sepsis. And that's...
Say that again, Nikki.
So neutropenic sepsis. So neutropenic means low neutrophil count. And neutrophils are one of the many amazing white cells we have in our blood. So in our blood, we actually have... Blood just looks like, it's this amazing red liquid. And I guess what we think of when we think of blood are red blood cells, which carry our oxygen around. But actually, there are also white blood cells, and there's lots of different types. And one of the types of white blood cell are neutrophils. And they're really key because they fight bacterial infections. And if you've had chemotherapy or some forms of immunotherapy, then you can have a very low neutrophil count. Most of the people that have cancer treatments are warned about neutropenic sepsis. So anybody that's had a cancer treatment or chemotherapy is known to have a low neutrophil count and develops any sort of fever is considered to be an emergency, and they are admitted immediately to hospital for treatment. So these people are particularly vulnerable to sepsis, and we have to be very, very careful when we see those people.
And so presumably if those people do have small cuts and grazes, they should be very careful.
Particularly vigilant.
Yeah.
And not only that, but they should be very vigilant at trying to prevent. So when my husband, who's had chemotherapy recently, was basically told, if you go on a long walk full of brambles and things that are going to cut your skin, then that's a really stupid thing to do at the moment.
Okay, yeah.
So just being sensible, now is probably not the right time to go and change that light bulb in case you fall off the ladder, but just because you can't deal with routine infections in the way that you would normally be able to. So just be sensible. If you're having chemo, then just be really, really careful because your immune system is not normal at the moment.
That's very interesting. Actually, I hadn't considered that. So, Abby, can you tell us a little bit more about the charity? So I know you feel very passionate about it and the work. Tell us a bit more about it.
So the charity is called Sepsis Research Feet. It was started in 2013 in Scotland, and at that stage was called FEET. And FEET...
As in F-E-E-T?
No, as in F-E-A-T.
Okay.
And it was the Fiona Elizabeth Agnew Trust. And the reason for that name was because in August of 2012, an Edinburgh GP who was very heavily pregnant with her second child became seriously ill very suddenly. She'd had an otherwise very healthy pregnancy. She'd had an antenatal appointment the day before, but she became very ill. She was admitted to hospital, and tragically, within the next 72 hours, a baby died and Fiona herself ended up losing her life. So her husband, Craig Stobo, started the charity the following year with 6 of the couple's closest friends, who happened also, many of them, to be medics who had known Fiona professionally. And they started the charity with the aim really of shining a light on sepsis, of finding out why some people were becoming ill with sepsis and improving outcomes for patients and saving lives. And, part of that was awareness. They wanted to see much more awareness of sepsis, but also part of it was clearly the need to fund research, because sepsis is still a deeply misunderstood condition, even in this day and age.
Well, I'm shocked to hear, considering how much we know about cancer, I'm shocked to hear the statistics you quoted earlier on and how little I personally knew about sepsis before we started this talk. So I'm sure that there are many people in my situation. So
I think there are still too many, really. And I think we talk as a team to sepsis patients, sepsis survivors, but also those who've lost loved ones to sepsis. And we talk to them on a daily basis. And almost without fail, what people will say is, I wish I had known what sepsis was, and I wish I had known what to do. And so as a charity, it is one of our key aims is to make sure that it just becomes widely known in the same way that, there have been major public health campaigns in the last 20 years for things like meningitis, for strokes. We want that same awareness of sepsis. As I said, without scaremongering. We don't want people to walk around being fearful. We want them to be aware, and we want them to be equipped. And then, yes, the research. So in 2018, the charity was a founding partner in a project called Genomic, which is a project running at the University of Edinburgh looking at the genetics of sepsis and critical illness, why it is that some people are more susceptible, and identifying key treatments.
And presumably, do you fundraise for that?
We do.
Yes. Yeah.
Absolutely. Yes. So we have a an amazing body of supporters who will do everything from, marathons to goodness knows what, abseils and inflatable 5K runs and all sorts of, but, also not necessarily physical challenges, lots of challenges that are undertaken by supporters who don't otherwise have the ability to undertake a physical challenge. So yes, amazing fundraising.
So we have a lot of athletic listeners. They're all athletic lots. So if any of you fancy helping,
Absolutely.
Abby,
That would be amazing. Yes, please.
get in touch.
That would be good.
Yeah,
that'd be brilliant.
And are there other charities or places that people can turn to for help?
Absolutely. I mean, there is another sepsis charity in the UK, the UK Sepsis Trust, and they are very good at raising awareness. They have very high profile awareness campaigns. They do a lot of work with clinicians. They offer the ability for people to get in touch when they've just had sepsis, and they can offer support nurses. So they're playing a really key role on that front. And then, as I say, the charity that I work for is much more about awareness too, but also about the research, funding the research, finding answers.
Now, if there are teachers listening and they want to help by raising awareness in schools, could they get information from?
Absolutely. We do have a schools pack that we produced, which was very much aimed at just that. It was aimed at actually embedding a level of sepsis education into the curriculum. So whether that was through biology lessons or whether it was through PSHE, just giving pupils a little bit of an insight into the biology of sepsis. But yes, over and above that, we're very happy to work with schools because I think that is fundamental, for children and pupils at a younger age to start to understand. You're really starting to build awareness for the future.
I wondered, Abby, if you had a take-home message or something, one thing to sort of leave our listeners with to remember about sepsis that we can leave them with.
I think I would say if you've had an infection, if you think you've got an infection, if you feel worse than you've ever felt before, then seek medical attention. And as you have said earlier, don't be afraid to ask the question. It's not a silly question. Do you think that this may be sepsis is such an important question and it needs to be asked.
Thank you. That's been really, really informative.
Thank you.
It's a pleasure.
We hope you've enjoyed this month's podcast. Don't forget that if this has made you aware of troubling medical symptoms, you may need to see your GP.
This has been an I Am Listening exclusive podcast. For more information, head over to our website, im-listening.co.uk.